Well, good morning. I'll call the meeting to order. The open meeting law has been met by the proper posting. We have an agenda in front of us. I'd entertain a motion to adopt the agenda.
Do we have a form then? I don't think
No.
We still don't have an official.
Okay, then I guess I won't ask for a motion.
Again,
We'll just try to look at it and pretend it's there, I guess, so. Yeah. Any questions on the minutes from the last meeting?
the last unofficial meeting.
Right. We only meet every 2 months, and now 4 months in a row, we aren't official. That's too bad. Okay, then I guess we can jump to number 6, and Kelly, if you want to do your thing.
Should I introduce Kelly, I guess? Yeah, so.
I guess we
so-
should have introduced
yeah.
everybody,
Well,
but
that's
sorry.
No. Maybe we can do intros maybe after Kelly, because then, okay. But this is Kelly Sweat, and Kelly is our Department of Human Services fiscal manager. So had asked Kelly to come today to just kind of review a little bit about the budget for the ADRC and just kind of to go over some of the, I guess, just more relevant fiscal pieces, things that we need to consider when we talk about programs and services for the ADRC. So, yeah, so welcome, Kelly.
You turn it on.
Okay. Well, thank you all for having me. It's just given me an opportunity to kind of go over with you the budget for these areas. I did give you a copy of the ADRC and aging budgets that have been adopted for 2025. I thought that would be better than trying to go backwards and explain 2024 when that's almost done. Most of the things are pretty similar to what you may have seen in the past. There are some things that will look a little different, and that has to do with funding sources. We've been improving, aligning things with certain staff and programs for the upcoming year. All of the ones, let's see, where do I want to begin? One thing you'll notice, and I'm sure you're aware about, is there is not a volunteer driver program on this budget. That was terminated in 2024, so that is different. I'm just making myself some notes as I go through here because some of these things still need to be updated. Let's see. Trying to think. Have any of you gone through the budget before, like line by line, or any involvement with the budgeting process? Maybe start with there. You have? Okay,
In the past.
okay,
and I have from the board perspective.
okay. So the ADRC has basically two sections, two groups that we look at for budgeting, the ADRC itself and then what we call aging. It helps me think of it as aging as our Title III services, and that is a specific type of funding from GWAR, the Greater Wisconsin Area on Aging something. Those are all of the other accounts you'll see on pages 2, 3, 4, where it says Title III, where it just has Roman numeral 3-B, -D, -C, -E. All of those are GWAR-funded programs. The one that is not is our Specialized Transportation Program. That is funded through our 8521 grant that Melissa applies for each year, has to go through the budget and apply for, correct? Yep. Now, with the GWAR funding, it is not 100% funded. There is a minimum requirement of 10% by the county, which it ends up being a little more than that. Just as prices go up and things, it's hard to keep it under that. Some of our more expensive programs are like home delivered meals. That actually takes a little bit more levy than we would like, simply because we get more funding for our congregate meals. They really want to encourage people to get together, get out of the house, socialize, and meet for those meals than be isolated in the homes. But that is a very important program, as I'm sure you're aware, because as our staff go out and actually deliver the meals, they are checking on those residents as well. I'm sure Melissa's gone over with you the red flag and stuff like that. So obviously, very important program for our clients in the community. Does anybody have any questions so far? Let me go with that. I don't know where to go.
I just have a question. You have
Yes.
several places where you have supplies or membership, and it said 0. Is it just not done yet, or?
Nope, this is complete. It's, some of the lines carry over, and we no longer have to pay for fees or supplies out of that. So there is no money budgeted for that because we don't have to take it out of that budget.
How do you get off the supplies budget?
So some of them are through the ADRC. As you will see, if you look on that first page, the ADRC, they have office supplies budget and stuff like that. And that can be used for any program out of the ADRC.
Okay, so it's transferred.
Yes, yep. Some of them, yeah.
Somebody that doesn't know anything.
No, that's perfect, that's perfect. That's the whole point of this, is just to help you guys understand any areas that you might not. With GWAR, it is directly tied to consumers, whether it's an individual consumer or a group of consumers. We have to have that data to claim that expense. So there is another program where that data is entered. So that's why it's important where Sammy goes out and does applications for people and stuff like that, that they become a part of this, because their information gets entered. GWAR expects us to be able to tie every expense we claim to a specific person or group of individuals.
Detail.
Yes, yes.
So maybe something to think about, for those of you that have maybe been familiar with aging services in our county for a long time. Years ago, there was the senior services, if people can remember that. And the senior services, for the most part, did the nutrition programs and they did the transportation. And so I don't know exactly what year that would have been, but at one point, ADRCs, so again, now those have been in existence for 25 years. ADRCs, and in our county, they decided to join senior services with ADRCs, which many, many counties did. Not all of them have joined those. So you do have some counties that they just have, like their aging unit, and they operate some of those programs, like the GWAR programs, which again, the most popular would be, or most common would be the nutrition programs. So I don't know if some of you, yes, probably some of you do remember that. So yeah, that's an example of just decisions that our county has made. But then the ADRC, like if you look at the very beginning, the Aging and Disability Resource Center, then that's getting into the Department of Human Services and the ADRCs. So.
And the reason they are separated that way has a lot to do with funding sources as far as budget-wise. The ADRC, we get most of our funding through what is now called GEARS. It used to be called CARS, and they had to change the name last year. And then, like I said, Title III services are through GWAR. And we have the 8521 grant. So a lot of the reasons that these things are set up this way on paper is due to those funding sources.
Just to point out too, if looking at, for example, page 2, you can see the 3D, the preventive health. And so, for example, Kelly did say that would be, again, an aging or a GWAR program. So that gives you an idea of exactly how much money we get. We get over $5,000 to operate our health prevention programs. And again, those are very, very specific about what we can do with those dollars. but a lot goes into managing that 5,000 and odd some dollars. Very, very specific requirements, very specific tracking requirements as far as entering. You know, for example, if Kelly were to enroll in one of our health prevention programs, we have to monitor her attendance. We have to then enter all of her information into the state data system. All of those things need to be done. And again, very, very specific about what programs we can use those monies on. I can't just say, I want to do a yoga class and I want to operate it here at the courthouse. That's not the way that works. Very, very specific.
Which I do understand, not only going over a budget, but my actual day job is in human services, so I bring that real life experience. And there is a lot of state, whether it's here or any state, they're very, very strict
Yes.
on your paperwork and all that too. They're getting even stricter. So doing that in real life, that is so true.
Yes.
Yep, right. And so, you know, I guess you all can just look at this a little bit, become familiar with it. Kelly did mention too on page 3, that specialized transportation program. Every county is eligible to receive a transportation grant. Our funds are right around $90,000 that we get to operate transportation in our county. I had just read an article that said the funds have been stagnant for 5 years or more. So we're not getting more money to operate our transportation programs. And that's just an example of right now we're using all of our funds to operate just the busing and our local transport. So there is no extra funds to be able to provide out of county transportation. But that just gives you an example of just, so all of those are just these different programs that we operate. Yeah.
That's where it gets interesting, because some of these things are mandated, whether we have the funding or not. You know, they did talk earlier this year about reducing the amount of funding for the ADRC. They decided to hold off on that. You know, there's a big misconception out there that ADRCs receive all of this money. Yes, when you look on paper, we receive funding. However, when you see what the cost is for the required services, you know, it doesn't cover it. And a lot of people look at it and say, oh, well, your wages and salaries. However, we have so much knowledge in the ADRC from the staff that are there. They've been there for years. It will take new social workers many years to acquire that same knowledge, you know, and when you go to get help for you or a loved one in these areas, you want somebody knowledgeable, somebody who knows what they're talking about. Otherwise, you know, you just need that level of expertise, so.
Question and maybe a little bit of promotion or congratulations. The congregate nutrition program income, the $49,000. Now, is that from the $5 donations from all of the different people that participate? I think that's fantastic. I had no clue that much was collected on an annual basis.
Yes.
Yeah.
And that is actually a requirement. They have worded it donation in the past, but it is supposed to be a contribution. Clients are expected to contribute to the cost of their meals. So regardless, you know, like when they did the RFPs to get bids for meals and things like that, they have not increased that ask. It's just whatever they can contribute to the cost of their meal. That way they are paying something, but it's whatever they can.
But yeah, you see it is.
It helps.
Significant, right? Yeah, right.
Yeah, absolutely.
Meals too, I know there's,
Yes,
it's 69,000 is what you're anticipating?
yes. Based on past, yes. And then if you see below that WWC, I don't remember what that stands for, that was before my time, but that is monies we get reimbursed from family care programs, like Inclusa and Iris and things like that, so.
Kelly, I don't know if maybe you'd want to just mention then how the move to the government center affected our budget?
Excellent point. So the reason we wanted to kind of push things along and make it happen sooner rather than later is because obviously we're trying to reduce expenses where we can. By having the ADRC move back over here and be under our roof before the end of the year, we saved roughly $30,000 in their budget between rent and utilities and internet. So, and it worked out very well. Our Children and Families unit moved to the old Sheriff's Department, and then we had enough offices then for the ADRC staff to move in.
As a county board member, I'm sure Don we do appreciate
Yes,
saving the money.
yes.
I'd like to, after this meeting, if you don't mind, go to your area. I don't know where you live right now.
Yeah. And that,
Not time today, but someday I'd like to see it, the new area, that'd be cool. Yeah.
and I will say to Melissa's credit and her staff, they have made the area much more homey and inviting than it was before. Yes, and that is another reason why it worked out for the Children and Families staff to move, because their offices, even though we're not close to the front door, they were closest to the front door under the Human Services area. So it's still a little bit of a trek for people to get to, but hopefully that will be improved down the road with a remodel.
I think it's good just to give the board this knowledge and information. I think this may be the first time that they've actually seen this kind of data in this group. I think it's going to be especially important that we start to kind of have more of a knowledge base when we start making decisions regarding congregate meals next summer and next fall. I continue to regularly receive calls from businesses, restaurants, caterers. The question, I think it was just not last week or the week before, and it was just kind of like, yeah, we want to sign up for, providing senior meals, maybe a Monday through Friday type of thing. I've gotten that twice, I would say, in the last month. So I think it's good for you all to have this knowledge. And so when people ask you as well, because you may be out and about and you may be fielding these kinds of questions, so that you're able to tell them, well, we're currently about to enter our second year of our RFP, of our contracts with our providers. And so unless additional levy money is put into congregate meals, or if something happens with our government, at a state level or fed level, that they're going to contribute more money to our programs, in order to add more days, we're going to need to have more levy to go into this budget. Otherwise, the costs are always increasing, right? We know that when we enter these new contracts for 2026, they're not going to go down. It's not going to cost us less to provide these meals. So we hope we can keep things where they're at, much less add more days.
Right. What when it's time to do new contracts, does any provider have an opportunity to submit?
Yes. So what we have always done is when it's time to open up the bids, we sent a hard copy, like a paper copy, to every business, every restaurant, every caterer that we know of. So literally looking in, online and searching. And then we also we put it in the newspaper. It's always ran for at least 2 weeks. So
those people who inquired could have an opportunity to.
they all could.
in
And
a
I
new
tell them
contract
all
period.
that. I tell them all that. And I said, stay tuned though. Next summer, probably the end of the summer is when that paperwork will again go out. Because then we'll have to make decisions by the end of by the end of 2025.
When you put together in the next newsletter, maybe you could put some little blurb in there about the congregate meals that, the budgets, we receive, the 69,000, and the people contribute that's not, I'm in the wrong place here.
That's okay.
So the income is the 79,000, but people contribute through their $5 donation, 49,000, to help cover those meals, and kind of explain that that's kind of a suggested I don't know how you would word that. But if you would care to give more, you know, you certainly feel that you could give more. You know, because I myself, you know, yeah, I put in my $5, but I could put in more. And maybe there are other people that, you know, if they got that little push, which would
Right.
help with the budgeting.
But I wonder if people understand that, you know, the more they contribute, the less goes on to the levy. You know, I don't know if people understand how that works.
Yeah, because then it's the levy, not everybody's paying for us 10 people to eat or, you know, whatever. I don't know how you'd
No, I
put
think
that in
that's-
there,
I
but
think that's really good. I don't know if you remember, Colleen, I'm looking at you because you attended that regional meeting in Eau Claire. And, oh, okay. Okay. Okay, because the state does give us guidance of different language to use, and when we did our menus for December, we did try to use some language. I don't know if any of you look at the menus, and it was tweaked a little bit to stand out and look different than what it has. But I think that's a really good point, and I can look at the newsletter too and try to adjust it. But I do feel like even I think the message could change regularly, and the state recognizes that the wording and the language that we use can encourage increased donations. So I think that's a really good point. Because we do
When people hear
kind of,
donation, they think, oh, I can give, but I don't have to. When in reality, it's an expected contribution, it's just not a set amount. And family members or anybody can help, you know, can donate. That is a whole separate thing, though. We can't just put that into the income. We would have to create another revenue line for donations.
but yeah, so looking at just this current newsletter, it just says, yeah, the suggested donation, $5, payable at the meal site. We can definitely.
Or more.
Yeah. Yeah.
How about not using donation and using contribution?
That is what,
You have to
yes,
say
that,
donation, Because then people assume that, well, I can give or I don't have to give.
Correct.
If you said contribution,
yeah. So the state, every year, they come and they assess our programs completely. And they look at every document that we give to people. And so that is something that they look at. Like Kelly had kind of mentioned, it wasn't all that long ago that the contribution was the correct terminology, and now they want it suggested donation.
Just a clarification too on, this is, you know, like Cafe 60 and then all these other 60 and over, but also people that have developmental or cognitive disabilities are allowed to come at the $5 level, basically. If somebody brings a guest, do we know how much that cost would be? Like if somebody comes to Cafe 60 that doesn't qualify in either of those and has a meal, how much that would cost?
It is 14 something. I don't know offhand
14
what
and
it
change.
is. At the meal sites, there is a little flyer that it does say how much,
Okay.
yeah, that if I were to go, how much it would cost.
And that is also another thing we have to track, how many people are partaking in the meals that don't meet the other qualifications. And that gets documented as well. Something that's not on this budget because it was not planned for, we do have some ARPA funding for certain programs that will now continue into 2025. Of course, not the congregate meals or home-delivered meals. The ones where we need it the most is not where they're continuing ARPA funds. So any funds in ARPA that we did not use up completely in the 3B supportive services, the 3D preventative health, or 3E, which is NFCSP for short, that's our caregiver program. Those funds will carry over to be used up in 2025. So those are not on here because we were not expecting to get them back in July. When they were to end at the end of September, that was supposed to be it. But, so that's a little extra funding we have just in those three programs.
Other questions?
I just want to make a comment that it's interesting to hear after being retired for over 10 years that we still have unfunded mandates because I haven't heard that in a long time.
Yes.
You know, you have to do this, but we're not going to give you any money.
Yes.
You know,
And there have been funding sources that have gone away in the last decade. Just to point out on that first page for the ADRC, if you look, again, I guess I should explain for those of you that aren't familiar, the top section, all of these .111 through .724, those are expense lines. So those list all of the expenses. The next little group there of 4, those are our revenue sources. So you'll see through gears, we anticipate to get reimbursed for $391,000. The next 2 are 0. The FFP, that was a federal financial participation funding source that ended several years ago, and that was previously on the budget for $100,000 that we no longer get. So that's why we're trying to do, how do we get the most bang for our buck? Obviously, we want to be doing that regardless, but
Kelly, do you recall when the state had originally released those figures and that we were going to be one of the ADRCs that was going to lose funding? Was it around 70,000? Was it, do you remember?
I don't remember off the top of my head. I know it was a percentage of our funding, and it was a pretty hefty amount. Their thought behind that, I don't know if any of you are familiar with that, is they wanted to try and equalize out the funding amongst ADRCs, and because this ADRC was a Generation 1, one of the first in the state, correct? They received the most funding. And they wanted to change that and take away some of our funding and give it to other ADRCs that maybe didn't receive as much. Even though in the beginning, Trempealeau County ADRC was informed that they won't be penalized, that would be their level of funding. Well, once word got out that that was going to happen to many ADRCs, people voiced their opinions, and it is now on hold.
So that is an example of just advocacy that was done in our state. Otherwise, we would be looking at cutting staff, really would be the only way that,
And staff
or
are-
contributing more levy, which that's never a good option. So
And staff have already been reduced over the years. It's my understanding we used to have 5
5.
INA workers, and now we only have 3. So as our population increases, we have less staff to help them. Trying to think if there's
trying to
anything
think,
else.
too. I think it's, just a really good, helpful.
Yeah, not to be Debbie Downer on all
Overview.
of the fun topics, but on a positive note, we do not anticipate needing to dip into our reserve account for the congregate meals or home-delivered meals in 2025. Part of that is because we did have the ARPA funds to still use for this year, and they look at that. And we can do what's called a transfer of funds. So at already back in September, October, we have to do a budget for 2025, and you can make a one-time transfer where here's how much you get for congregate meals, I'll say, because that's where we get the most funding, and 3B and home-delivered meals, and you can transfer up to a certain percentage between those programs. And so we have requested to transfer money from the congregate and 3B supportive services program to home-delivered meals to also help pay for those. We are guaranteed a minimum percentage. I'll say it's 20. You can request up to 40, but depending on how all of it works together with other requests, you're not guaranteed more than 20.
What reserve fund are you referring to?
So there is I want to make sure I get my terminology right, because we have equity accounts, we have reserve accounts. We have a reserve fund account for meals specifically. I don't know when that was created or where, how that came about, just being into this for a year and a half, this role.
We don't know where those funds came from.
In the beginning, I do not.
I don't know either.
How much are we talking?
In one, there is $300,000. But I know the hard part is some of it, depending on the fund, like that fund, I believe specifically they call it reserved because it is reserved to be used for certain things. So we can't use it just to fund like the home delivered meals and stuff like that necessarily.
Depends on what it's been tagged for.
Correct.
Yeah, so we're going back a ways. I
Yeah.
don't know.
It'd be good to know what the tags for those funds are, though.
Yes, and I just need to ask Paul. So those aren't things that I can just readily look up in our current system. I have to go through Paul.
Okay. It's good to know there's a little reserve out there.
There is, there
But you
is.
don't know where you can use it, that it makes it hard.
Yeah.
Yeah. Just one other thing maybe to mention is the DCS role and what had happened with that as well.
Yes.
So the dementia care specialist, that had been a position that the state had funded, a full-time position. And then when Becky Kamrowski, our full-time DCS, left us in January, I believe, of 2024.
January, February.
February. Yep. The state then removed our full-time position and gave us only funding for half-time position. So
They used to give us $80,000 for that, and they cut it down to $40,000. So now to try and still have a dementia care specialist, that person is part-time, and we are splitting some of their costs between that dementia care funding and the AFCSP program, which is Alzheimer's, and then the NFCSP program. Now, the AFCSP and NFCSP don't fund a lot because it's only a percentage of that grant amount, not of their salary or anything like that, but it does help offset. So it does, between those three, it allows us to have somebody who works between 20 and 22 hours a week doing those programs.
just started, 2 weeks ago. So that just does give you an example, and it's not always based then on the size of a county. So there could be other counties even smaller than us that have that full-time funding from the state. But of course, if you have one person that's what their entire job is devoted to dementia care specialist position, duties, they're going to be able to provide more programs and services. So it's unfortunate because it, again, without advocacy probably done again at the state level, I don't see that that's probably going to change. So again, unless there is more money that levy funds that went into that at some point, that's probably the way that will continue, so.
Does the ADRC still have that? There was a position, I think Penny Paulson was in it at one time. I don't remember what
The
it was
community
called.
health?
Yeah.
No, so that position, the funding for that grant ended in August, and so no, there is no other funding for that.
That's always the risk with these grants, isn't it?
They start things and it goes great, and then they take away the funding, but people can't always continue.
But again, the dementia care specialist, that is an example of a position that is mandated. Every county has to have a dementia care specialist, and so it just, some have full-time, some have half-time.
And finding somebody with knowledge and desire in that field, but to only work part-time, that's another challenge.
In the small county,
Well, and
in our rural county.
yes, and the expectation is not to always have things during the day as well. The expectation is to have groups and things like that, and that could be any time that works for clients. I mean, they're not going to schedule it, per individual, but if they are holding groups, you got to see what works for the majority. So. Yes.
Anything else for Kelly? Kelly, do you have anything else?
Not that I can think of, but I will look into the reserve accounts, get some information from Paul on that, and relay it at another meeting.
Yes, thank you for coming. good information. For me, it's kind of like reading Greek because I was not a financial person. I'm more of a social worker than, and we didn't have to figure out budgets and, yeah.
And this is kind of like reading Greek, just because everything is different.
Well, one of the things I'm curious about, Kelly, and I guess I'll just ask it because it's been driving me nuts for a long time, and it's not just on your budget. So there must be a reason for it. But so like you said, that FFP is no longer a funding source. Why does it even have to be a line item?
I do not know. I have asked to remove certain things, and that hasn't happened yet, so now I gotta go back and ask, because I don't get to be, I can put on here what our proposals are, but the final product is not up to me.
Right. I guess I have seen that though in other budgets too, where they continue to have like line items that are zero. And it just, if it's consistently zero, why is it a line item? It just muddies the water in my opinion, but.
And if it's something that we could get back, then maybe they want to keep it on there. But certain things like this FFP, that honestly has been gone for almost a decade. There's no reason to have that on there. But if I didn't make a note to specifically remove that, I think that's why that's still on there.
Sure, okay. Now I'm
That's
done.
one of the things to make notes. Because if you see on the ADRC page, .592, I don't know why that is on for the ADRC. MAT and client services, that's medication-assisted treatment. That doesn't apply to the ADRC. That's for another budget. So I don't know why that line is on there.
Okay, well, thank you again for coming and
Yes.
explaining it. And there may be people that, if they're watching on TV, might have some questions they could call in, I'm sure, and ask them, because we don't have direct communication with them today. But I'll be out in the community and somebody will say, oh, I saw you on TV the other day. Where would that be? So that happens. It was my mistake. I didn't do introductions at the beginning. So Beth, if you would like to start and keep it under 15 minutes.
Beth Killian from Arcadia. That's short.
Yep. Push your button when you introduce.
I'm Joan Sasala, and I am here as a new person that's not even on the board yet, but Melissa asked me to come considering being on the board and being accepted, and it's very interesting. Do you need to know anything about me? I was
willing to just share a little bit about
okay. I started out as a speech clinician, and then I was a learning disabilities teacher here at Whitehall. And then for about 5 or 6 years, I was principal at St. Peter and Paul in Independence. And then I worked for Western Technical College, and I didn't do it myself, but I was one of the people that built the expansion of the campus in Independence, and I also started a campus in Black River Falls. And then when I finished my doctorate, I became the Stevens Point executive director of continuing ed, and so I was in charge of all the off-campus stuff, all the training centers in the central part of Wisconsin. And then everybody in my family got sick, and I took an early retirement, got everybody, nursing homes, whatever, and worked for Western Dairyland for about 3 years to get to know more about the county and the area and the counties around us. I just feel a need to do something more for people that are having some difficulties. And then I did that for about 3 years. And the last 4 years I was at UW-Eau Claire, and I helped with grant programs that helped adults go back to school. And then I got to the point where my body was saying, you're not going to work every day. And I have chronic health issues, so I had to retire. In all the time that I've been working through all these careers since about 1992, I've also had my own business as a coach, a life coach. And my specialty was transitions, people that are having to change their lives. When I was doing my doctorate work, my minor is in learning disabilities, but traumatic brain injury. So that's me. I've just kind of been retired now for about 8 or 9 years, and I did my coaching for a while, but now I decided, you know what, you're old enough, your body's ornery enough, let's just not do everything. So that's me, kind of a quick summary.
Wow. Thank you for sharing, and with all that, you must be at least 110 years old.
Believe me, when I get up some days, I feel like that.
And I guess our paths crossed a couple times in the
Yes,
last
yes,
year
yes.
through the rainbow.
Well, well,
Right?
the Red Hats,
Red Hats.
I belonged to that, one of the last chapters around independence, and I invited them all to my house, and I invited Melissa to come and speak to them because I knew a number of them knew but didn't know, and I thought, gee, there's some things they can become more involved with, and they have been since you visited. And then when you were also at Pigeon for the Trempealeau County Retired Educators, I was there with you
yes,
at that
that's
time.
true.
I belong to a number of organizations where I can do things in the background, but I can no longer do leadership things. So, but I still can really talk good.
And you are a friend of Dora Jean.
Yes, Dora
correct?
Jean and I have been friends for 50-some years. I was her organist whenever she sang for weddings or in our church at St. Peter and Paul. And so we've just been close friends for a long, long time. And she talks with great, great admiration for this area.
Sorry, I know I should know this, but I missed your name?
Joan Sosala.
Joan. Okay.
Yeah.
So, not son.
No, so
So, got it.
I had to, in order to remember my husband's name, I had to go SOS like trouble.
Perfect.
We got the Susalas and the Sunsalas. so
Yeah.
They're all
great
related.
number.
They're all related.
Are they?
They just, when
Wow.
they came over from Poland, they decided to, there's even some SOUSALA. And they all decided, maybe the brothers decided they just wanted to spell it their own way. I don't know.
Maybe. And I'm Melissa Youngbauer, and I am the supervisor of the ADRC.
I'm Scott Brown, representing the Whitehall area.
I'm Dawn Waldera. I'm a county board member. I do work for Tri-County Hospital also, and have worked in the healthcare field for 30 years this month. Yeah, oof, that's painful to say.
Rachel Herman, volunteer from Pleasantville.
Colleen Schwerke, volunteer from Osseo, and after being on this meeting, or on this committee and at several meetings, it's amazing all the behind-the-scenes work that has to be done to do these programs that people just don't realize the struggles. So kudos to everybody that's part of it.
Yes, this board does an amazing amount of work and trying to come up with things. And I think I read in the minutes, was it truly impressive work? The comment that you got. So, yes, that's great. Okay, advisory council vacancies. Betty Vold, you mentioned her name just a moment ago. She is no longer going to be with us. Dora Jean and Alan Robertson are all off of the board, and Phyllis Olson from the Blair area is hopefully going to join us. She's unable to be here today, and of course, Joan. And we also are looking towards representation from Galesville and Trempealeau. So if anybody knows of someone that possibly could join us in this wonderful endeavor, it seems like only every other month isn't enough to be here. But I just was asked to become a part of something that only meets one time a year. It's the Wisconsin Council of Churches, and we're going to that meeting in Mazomanie, Wisconsin, next Tuesday. So I'd be interested to see what that's all about. And then Wednesday I head for Texas. So, all right. Nutrition Council updates. Have anybody representing nutrition?
What I could maybe jump in a little bit too, Colleen. What I can just say is the Thanksgiving dinners. There were Thanksgiving dinners at all 6 meal sites. And I know we had upwards of 80 people at Pine Creek. Yeah, isn't that amazing? The attendance was really high at all of the sites. I know that recently we've had up to 80 people at Cafe 60 in Whitehall as well. I don't know what the numbers were last week, but just overall, the Thanksgiving numbers were really, really high. So that's pretty exciting.
People really like the food.
Yes, they do.
A couple of things that were mentioned was people like the cultural dinners and, would like to see those continue to happen. And I guess I've not been to the Wanik Center for a meal on a normal time, just for our meeting. And I guess they're struggling there to get their numbers increased, to see why people aren't participating there. So I don't know if they're looking at a different location, a different place that would do the cooking. I'm not sure why they're struggling there. And I think everything is brought in, correct there?
Yep.
So that might be a part of it, that maybe the food isn't warm enough, or just the atmosphere. I'm not sure, but they're struggling at the Wanik Center.
Since Cafe 60 opened, I think a number of people, instead of driving all the way over, I'm one of them.
Will go
I used to
here.
go
Yep.
almost every Wednesday, and now I go over here.
Right.
But the food was always good. I
Yep.
never had a bad meal over there, and the people enjoy each other, so I'm not sure either what the problem is, but
I know we're trying to explore that. I will say that not last week, but the week before, I had visited with two ladies in Blair that had recently completed that dining passport. So it had eaten at all of the meal sites. And I specifically asked them, these two ladies, and their home site, the site that they attend every week is Blair. But I did specifically ask them about Arcadia in addition to all of them. But they had very positive things to say about the food, about the location, about the other diners and the volunteers there. So I don't know. We'll just have to continue to explore. There's got to be some reason, because out of all of our sites, that is the one site that is not averaging. Most of the sites are 25 or higher averaging.
All the
and
counts
that-
are higher. Yeah.
And that one there's been times where it's 9 or 10. That's not atypical for that site, so.
Yeah, I was able finally to attend with my schedule a few weeks ago, and I went into the wrong room. I went into the normal room and was like, oh, we ate in the little small room, and it was a very small crowd. And then we did get back in time on Tuesday so that I could go to the Thanksgiving meal on Wednesday, and I think there were like 33 people there, a good crowd. The comments that I heard, I didn't talk to everybody, but that there was so much food. And there was. I took leftovers and I ended up having Thanksgiving for supper too. But I don't know what the scoop is there. I try and go, but for me, it's like I'm not there, or, it doesn't work out. But there are a lot of, that core faithful people that are there every time.
Do you feel like it's well advertised as a site? It's been a site for a long time, right? So it's not new.
No, there's 3 sites that are newer than that. So they're all advertised the same way. That probably is advertised more than some of the others because of the Wanik Center. It advertises it. So
I'm just trying to think about access to that building. Like the Wanik Center is, it's not terribly easy, but also it's kind of a busy area, and I wonder if people aren't comfortable driving in, that large, I don't know, I guess I'm speculating, but if I think about that area as opposed to some of the other areas, it's busier, it's bigger.
yeah.
Does that have an impact? I don't know.
It may.
Right?
Yeah.
How do you know? I'm just speculating, but
Yeah.
The, I forget what you call it, but the card, for checking off if you dined in all of them,
Yeah.
that seemed to be a hit.
It was a hit.
And I guess now for December, they're doing like a dice game.
Yes, yes.
So it's, the little activities to bring people together and to have some fun and socialize, so
Yes.
good things.
Yeah, that dice game is really neat. So I think all of the sites have them. Yes, and so it's just a sheet where you roll the dice and then they're conversation prompts. So like if you were to roll a 1 and 1, maybe it's like, tell us your favorite Christmas gift. And so those at the table will encourage conversation. Really fun. We played that game at that regional nutrition meeting too. So that's where we got that idea from. So I think it'll be really fun. And we have tried to do, I know that Christine at the Wannick Center did do she did a kind of a scam. She had somebody come in from Madison and do a presentation a couple weeks ago, and they didn't get anybody to come. And so I don't know. We did do a bingo. We sponsored a bingo activity there a few weeks ago and was not tremendously successful either. The people that were there, like you said, they've got their faithful of about a dozen people. They loved it. But it didn't bring in like massive amounts of people, yeah.
They're doing in December too at the one lunch, a cookie exchange, which they talked about, how do we know how many cookies to bring because you don't know how many people are here. And then a white elephant gift exchange. So they're doing some activities, but again, it's to bring in, because when it first started, there were lots of people there. And so I don't know why those people aren't coming back.
Just one thing to mention that when that started, we were still during COVID, and there was the practice at that time of the carryouts. And Kelly already had kind of mentioned the idea behind congregate dining is to get people out and to socialize. That site never did seem to fully recover. And as recently as in the last month, we've again had people request, can we start offering carryout? If you were to do carryout, then we'd probably have a ton of people again. Well, we might, but again, when we are limited in our funds to offer just a carryout option, I personally have not felt like that's a good use of our county dollars, because anybody could go into Ashley Pub, for example, and pay $10 and get a carryout. So I just don't feel like we should be supporting, it's congregate dining is about socialization. Defeating the purpose. Yes, defeating the purpose.
And sometimes they will not allow that. GWAR will determine, if it's for a congregate meal, then they expect the people to be present. If they're, they won't let you
Just to
get
kind of,
reimbursed.
some of you wouldn't have been around when that all happened. So, and I think it did, though, rub some people the wrong way. And some people are just like, okay, well, if we can't do that anymore, then we're not going to go. But that's getting to be a while ago, too. And the other sites, again, are very high, again, being recognized throughout the state of some of the highest attended meal sites in the state. So.
And the cultural meals, I'm glad to hear that people really like that. Unfortunately, don't know if there will be funding for that in the future, because a lot of our ARPA funds were used for that this past year.
Yeah, that was a nice program too. So the senior meals are wonderful. A lot of people from around here also go over to Taylor. I hear a lot of positive things about the restaurant in Taylor. I think they do 5 days a week, and I don't think you have to call ahead, and people just show up, and they get a lot of people to go to those. I haven't been there yet, but they rave about the food, and I couldn't even tell you the name of the restaurant, but just an informational thing. So Our next report is from our wonderful supervisor, Melissa Youngbauer. Melissa does a fabulous job with her program and her staff, and she's nice to me even, so take it away, Melissa.
Okay, just a few updates, and we've talked about some of this, but the transition to the government center has just been really wonderful. We even had Scott that loaned us some of his moving equipment to get some of our items over here, so we appreciate that. But just need to say, Kelly, so Kelly supervises the administrative staff for our department. And just having access to those staff and the rest of the people in our department, including my supervisor, it's been wonderful. I did not really realize how much we missed some of that support until we were actually here. It's just been a huge relief. And those gentlemen that work security, I guess it's always been gentlemen, I haven't seen females working, but they do a terrific job. We really have just counted on them and helping us get our consumers, those that need the extra help to get to our area. They've just been terrific. So to the point of either calling admin staff or calling us, and we come down and get people that do need a little extra assistance, or they've not been opposed to helping them. And maintenance staff too, they help as well. So just everybody's been super helpful. I don't know if you saw, there is 2 parking places, I think they're both up now, for closer parking for individuals that are coming to the ADRC. Because of course there's disabled parking, but then there's 2 parking spots.
I only saw the one when I came in.
Oh,
Maybe I missed, maybe it's in a different location than.
okay. One, okay, well, I'll have to ask Jeremy about that, because there's 2 different ones. So I know he was contemplating if he should put them both in the same, right in a row, or one on each side, so.
Right, so maybe it's
Yeah.
in a different part of the park.
No, I bet it's not then. I bet he just hasn't decided yet. So I'll ask him about that.
Melissa, if I could interject too, one of the home-delivered meal drivers had approached me a little while ago. Is there a specific place for them to pull up, to load up? Or do they have to find, because yesterday I was here to go to the clinic, and there was like nobody parked in the parking lot. Today, it's like maybe a third full, but other times I've been, there's no place to park, and I can walk, I'm able to across the street. So do the home-delivered people have a designated spot to
No,
load and unload?
They don't.
Because that's something that is probably pretty important.
So what I will just say about that is there's really not loading and unloading that's done here, unless they have on the occasion where they are unloading some of the like they're called the Oliver trays, which that doesn't happen that often. And normally, if they couldn't get one of the close by spots, then they could just wait until another day. But I would say very few of them have any loading or unloading. So I know it's been a transition for them. We're trying to make it as convenient as possible. I know that just yesterday, one of them had called me. They had lost their badge. So it's been a little bit of a transition for some of them, and a lot of them had not been into this building at all either before. So, it is an adjustment to the point of some of them were even getting lost in the building, and so I think it's going better now. But they would have to rely on just the parking that's out there.
Because I wasn't really sure what we were talking about, but I said I would bring it up. I was gonna wait till Old comments, but I might.
Yeah. Okay.
And kind of fit with the parking.
But we'll keep a close eye on it. Like I know the driver that you probably saw yesterday, he doesn't really do any unloading. Oh. Okay. But we'll keep an eye on it. Yes. Just a quick health promotion update. We are offering Strong Bodies again in January. I believe that this will be the 4th year that our volunteers, Amanda Heggie and Nancy Lingen are leading the class. I think this is their fourth year. We already have 11 individuals registered for that class, so that's pretty darn good, I think. That's going to be at the Whitehall School. We've also mailed out 6 additional packets, so that interest is really, really strong for that class, so that's awesome. Then we are also going to be doing a Stand Up for Your Health class starting in January. That's going to be offered at Brookside in Whitehall. So Stand Up for Your Health, it's not as well known as the Strong Bodies program. We did offer it last year in Osseo. Diane Richardson is going to be offering it. I think that Richardson, is that right? Okay. I knew it was I knew there was something like that. She's going to be offering it here. That program is not an exercise class. That is an evidence-based program. So again, it's one of these programs that the state is, encouraging us to offer. It's a program to help people learn strategies to stand more and for longer periods of time. So this program, it's been shown, there's evidence to show that people that participate in this program, they are up more. They're up on average of 68 minutes more a day than those that have not participated in the program. They really say it's for people that are sitting 6 or more hours a day. So it's pretty much for me, yeah. Right? And then, of course, it's just shown to improve general overall health. But that location, I think, for that class at Brookside will be very good because it's like that audience of people that typically are not, or often not leaving that building, so they'll be right there. I think that will be really good. How long is that? So that is a 4-week class. Yes, 4-week class. Wanted to just remind people we still are in need of volunteers. We're currently really in need of volunteers for Pigeon, Blair, and Whitehall for home delivered meal delivery. So just spread the word if you know anybody from those communities. Those are those shorter routes. So they're not as long as the routes that Colleen does. Colleen's route is is a little bit longer. These routes, I think Blair, on some days, there's only 3 meals that are being delivered in Blair. So they're short. They're really short. I did already tell you we hired a part-time dementia care specialist. I can give you her name. It's Trish Rodering. So she is joining us from her other position at the Trempealeau County Healthcare Center. So she's done work there for years, does a lot of their care planning for the clients that live at the healthcare center, and has a lot of experience working with behaviors. So she's trained specifically in behaviors. So I think that's going to be really good for people that are working with individuals that are out in the community and might be having some challenges. And then also just with her background and just knowing a lot about just facilities and how that works. So that is that. Wanted to just and I will have Trish join us, hopefully for upcoming meeting as well, so you can get to know her. But there's so much training that goes into that position, and we're really wanting to put some thought into the programs that we put into place here. So, for example, like the support group, really deciding where is it going to be, when, all of that, so that we just make really sound decisions before we start something. And then just wanting her to spend some time with some other DCSs around our region, just to know what is going to work best here. So. And I've just got one other thing I'm going to say, working on education presentations for first quarter. So January, we have a hospice and palliative care seminar that's going to be offered in Whitehall after Cafe 60. So people can eat and then head over to the library for that presentation. So I got something planned for January. No, I bet they don't know about that. So I don't know if thanks for joining us, ladies. And we really are almost done.
Yeah, I'll have to, I'm sorry.
I'll zoom in on
Okay. Okay. Yeah, thank you. I don't know if anybody has noticed, but the state changed our logo. So if you've seen any, I don't think we had it by the time this newsletter came out, but they had done even a survey. People were invited to do surveys to tell them what kind of logo that they wanted. They hired a firm that gave us examples. Yeah. Yeah. But some of the examples, it was interesting because my immediate response was, that looks like a hospital or a medical provider of some sort. They were very, very different. My feedback when I did the survey and when I had an opportunity to talk to the state was, people know our logo. Why change it? Why spend the money to change it? So that is what ended up happening, though, is the logo that was very similar to our prior logo, that's the one that they decided on. So the new logo is a little bit darker blue. So it is on the new sign. Like if you look at the signs out there, it is on there. It's a little bit darker blue, and they took away the ampersand. So you know the and they wrote out and instead of the ampersand. And the font is a little bit bigger. The Trempealeau County, like that part is a little bit bigger. But the good news is we can continue to use anything, like, so if we have pens, if we have the stickers on our vans, we can continue, we don't have to change any of that. Yes, thank goodness. And we received $19,000 to purchase new marketing materials. So, but we have until the end of February to purchase those.
So look at what you're gonna need next year.
Yes, so we've bought some pens already. We've bought some folders. In the past, we were just buying just plain blue folders, but we bought some now that they're printed, that have our logo on it. So anything that has our logo, our new logo basically, is what the funds can be used for. Yes, so we'll be looking at some signage. That's kind of the higher ticket item that we hope to purchase. Some new signage that will go into our new lobby to have that done. So that'll be good. Yeah, planning ahead as much as we can. But so it's a little bit fun, but we don't have a lot of time to spend it either, so. Yeah.
I worked in the courthouse when the ADRC was beginning, way back when Becky Severson was trying to put it together, and she and Stacy Garlick. And I was always surprised at how much money was put into things like pens and handouts, the public relations and, TV and radio ads. But that's huge. I mean, that's what gets the word out, and it's something that needs to be done.
Yeah, it is different than I think every other unit in our department, because that is a key component of the ADRC, is that we do have to do marketing promotion so that people understand the services that we do provide. They want people to know about. They don't want it to be hidden or to be kept a secret. So, and there is all kinds of just data that even does show. So it is interesting, even on the front page of our last newsletter, it talks about how in 2023, what the state is saying, that every $1 invested in the ADRC yields $3.88 in savings, primarily by reducing hospital readmissions and emergency visits among Medicare beneficiaries. And, right now, that's what, with open enrollment, we have one staff that's what just all of her time is dedicated to well, really, we have two staff that's what most of their time right now is dedicated to, just open enrollment and helping people save money, so.
Thank you, Melissa. I just want to put a stamp, I guess, on the scam thing that people missed out on in Arcadia. I was able to attend the one that was held here at the library. I learned about it because they had put out ads, just on the tables at senior meal program, and I thought, oh, that's tonight, and happened to not have a confirmation class to teach that night, so I went over there. It's incredible what is out there scam-wise and dangerous, and if you have an opportunity to take something in, please do. I mean, I almost daily I get emails, things about, oh, your package is tied up so-and-so, we need your address. Don't even, just delete. The other day, something came through on my phone. It was like a group text, and it was something about Bitcoin. And I just deleted that sucker right away because I don't know, that one is definitely, because I'm not involved in any Bitcoin, and AI is huge now. I mean, they can any member of your family, they can make a video based off of things they can pull from TikTok or Instagram or Facebook, or X is what Facebook is now, or Meta. I can't even remember them all, but. Yeah, it's difficult to navigate, and you just out of curiosity you want to click on those emails and things, but man, yeah, I mean they can open up and get into your computer when you do that sort of thing. So, any of you out there on TV land or here in the room, just be very careful. Even if something seems really good. Do a little research, don't go right to that phone number, but go to the main company. Let's say if Xcel Energy, is promoting something, call Xcel Energy, the number in the book or the number on your phone, not the number that's on that little ad, because it might be a scam. And you call them and then you get hooked. So it's scary and it's sad, but it's what life has become. Any other open comments?
I just have one. Yesterday, I delivered meals in Osseo to a gentleman whose birthday was yesterday. So I had baked him a cake. Well, actually, it was brownies, because I know he likes brownies. Put some candles on it, put a little happy birthday sticker on, brought it to his door and started singing happy birthday to him. He invited me in. I gave him his meal, gave him the cake. I also included a card that I signed with, hope you have a great day, and I signed it from the ADR staff and your drivers. And he just stood there in his kitchen, big crocodile tears coming down his face, and gave me a big hug. And he said, "How did you know it's my birthday?" And I said, "Oh, a little birdie told me." And he said, "You don't know how much this means to me." So whoever goes out and delivers those goodness cakes, but it means a lot to these people, so. It was, and he even said, "Please thank the people from ADRC." So I know this is a nutrition thing and this isn't the committee, but just so people know that those people that are shut in and, maybe don't have family around, recovering from surgery, whatever, sometimes we're the only human contact they get in a day, so it's important, so.
Colleen, can I ask, does he live by himself?
Yes.
Okay.
Yep, he does.
Did you know him before you started
A little
delivering?
bit, but I got
Kind
to
of.
know him more since, so, yep,
That's just so
yep,
heartwarming,
It
isn't
is.
it?
so.
Yeah, thank you for
Everything
sharing
that's
that.
being
you.
done on these committees, it's being touched and felt by people, even though sometimes we think not.
Right.
So,
Right. You don't always see it,
Yeah.
but
yeah,
Yeah, we
thank you, Colleen.
often don't know what our words and actions mean to people until maybe sometimes years later. I mean, I've had experiences where going back 20, 30 years from Boy Scout camp, and guys will come up to me and say something about what happened or what I said or something, and I'm thinking that was almost nothing, and it was very meaningful to them. Yeah, exactly. So yeah, being careful what we say to people, how we say things to people, it's huge. It's huge. Yeah, now with my Senate authorized minister position, I get out and visit lots of people in their homes, and And, I'm realizing more and more just how important that is to people to have that contact and just to go in and say hi and talk to them for, half hour to 45 minutes to an hour. And it's a highlight of their day. And it's just fun for me. So, that, it'd be nice for more people to be able to do that. Any other open comments?
Yeah,
Right.
right.
Human contact is huge. It's a big part of our senior meal program. People getting together and interacting. Anything more? Okay, well, I guess we've hit the end of our agenda, so I opened the meeting, but it wasn't official, so we will just adjourn. Thank you all for coming, and thanks for tuning in if you're out there on TV land.